The collaborative is a partnership between four organisations: North West Melbourne Primary Health Network, the Royal Melbourne Hospital, and two community health services, Merry Health and Co-Health. The collaborative is about these four organisations coming together to better support patients with chronic disease. So we look at ways where we can better join existing pathways or improve information flows or develop new programs where we see gaps for patients with complex chronic disease. What we're working on at the moment is developing a pathway for patients who are experiencing dyspnea with underlying chronic heart failure or chronic obstructive pulmonary disease. The patients that are eligible for the pathway all come through an initial Royal Melbourne Hospital admission process. There are a number of criteria. So at the moment it's a pilot and we're only looking at a small geographical area of patients. So patients are eligible if they live in the local government areas of Melbourne, Moonee Ponds, Moreland and Yarra. If they have dyspnea or shortness of breath, if they have underlying heart failure or chronic obstructive pulmonary disease. The GPs will be notified when their patient has been enrolled into the pilot, and they will initially get a notification through the hospital, and the PHN will also be notified, and the PHN will be in contact with GPs to say, here's some helpful resources and information, link them into the Health Pathways site that will have a pathway about this pilot, and be able to provide further support and resources for the GPs. Another aspect of the pathway is the introduction of community navigators, and these are positions that are employed in our two community health centres that are part of our collaborative, and these positions work with the clients individually to really see what their goals are for a whole range of health and non-health aspects. We know that there's all sorts of things that can impact health and well-being that are outside the scope of traditional health. So it could be housing, it could be social isolation, it could be financial assistance or support for carers. One of the key ideas of this dyspnea pilot and pathway is really to enable patients to be able to be treated more effectively in their community, closer to home, and not have to come into hospital for the majority of their treatment.